Hello friends, welcome back to Endo Tales from Life. In this episode, we are going to talk about the advanced ergonomics in dentistry. Yes, in one of our previous Endo Tale, we already discussed about the basics of ergonomics in dentistry. In this video, we will be demonstrating how your ergonomics can be improved further with the use of magnification, especially microscopes. So, I'll be giving demonstration on how to improve ergonomics with the use of microscopes and magnification, but even people who use loops can also apply the same. So without wasting much time, let's straightway watch the video, and thanks for watching. In this demonstration, we'll be talking about the operator and patient positioning for advanced ergonomics in dentistry. So this video will be especially useful for people who are planning to, who are already using some form of magnification in their practice, especially microscopes. So in one of my previous tale on the basics of ergonomics in dentistry, we had already discussed about the hazards of faulty chair positioning or operator positioning and the impact that can have on the dentist's musculoskeletal problems. So people who have missed that, here is the link or here is the description of that video. You can have a look at it, especially beginners who don't use magnification. This basic ergonomics demonstration will be very useful for you guys. So for people who already mastered the basics of ergonomics, how can we improve further, or how can we achieve the highest level of work precision, work standards, and also ergonomics? So the problem is, with the basic ergonomics, in spite of following all the principles without using magnification, we still do not achieve the best or the highest level of ergonomics, because you still tend to bend forward. You can see here both the back and the neck has to bend for me to achieve a proper vision. So what happens when we use magnification? You can see in this picture, when the doctor is using a loops for magnification, automatically her head moves away from work, but still you can see that there is some amount of bending of the back and the neck, but still it's far better compared to working with the naked eye. And here is a picture of me working with a microscope, and you can see that both the back and the neck are erect. So this is the biggest advantage of microscope. So apart from the benefits of microscope and the efficacy in the treatment outcome, we'll be discussing about the ergonomic benefits of using magnification and how to achieve that. So there are people who must be using microscopes for a few years, or people who have bought it recently, or people who have planned to buy it. I would recommend you to follow these easy steps for you to achieve the best out of dental microscope. So when we learned dentistry in our undergraduate school, we have been taught all these different clock positions for doing treatment on patients. So we must be knowing that. Even in my basic ergonomics video, I mentioned that for mandibular teeth, especially mandibular posteriors, we sit almost in a 9 o'clock position. When it comes to maxillary teeth, we come to a 10 and 11 o'clock position. But the basic difference is, in advanced ergonomics, especially when you use microscopes, the only chair position that you need, we work for all the teeth, for all the quadrants, is the 12 o'clock position. Yes, you can go little 11 or 1, but basically it is a 12 o'clock position for almost all procedures. So this is the only chair positioning and the operator positioning for all the procedures that you are going to do related to dentistry, and especially endodontics. You can see here the operator is comfortably positioned with his knees and with his elbow supported and his vision straight, both the back supported and also the neck is erect. So I'm going to teach you how to achieve this in this demonstration. Alright, so here is our basic setup. We have the dental chair, and right behind the dental chair is the operator stool, and on the left is the assistant stool, and we also have a roof mount microscope here. So this is the basic difference which we already mentioned in our basic ergonomics video. We need to have a chair with a double armrest and a good back support. So in my practice, what I prefer is the operator stool. The double armrest is used by me for as for the operator, and the one without that is given to my assistant. So if you can afford both the chair with double armrest for both yourself and assistant, definitely you can go ahead with doing it. So there might be some differences from what we are recommending and from what is being practiced abroad, because basically the difference in the brands that is being used and also the availability of those products. So basically there are some microscope chairs which are available from global and some top brands, but they are pretty expensive. So this is a simpler way of modifying a confident dental chair with a double armrest, which I have customized, asking the manufacturers to do it for me. So also with a good backrest. So this is my customized microscope operator stool. And you need to know that the nurse or your dental assistant needs to be sitting little higher than your chair level. So this is very important. So there are people I know who don't give a chair for their assistants. That is not a good practice, because your assistant also needs to be seated comfortably, and you should know that the height at which your assistant is seated has to be much higher than you for them to have a good look at what you're doing. So now we'll have a pictorial and a video demonstration of the workflow of how we achieve this ergonomics. So here we go. You can see my assistant preparing the chair for the patient to get seated comfortably, and she's also lifting the microscope high so that there is no interference in the patient's be getting seated comfortably. And now the patient comes, gets seated, following which the operator arrives, closes the armrest, and the first step here is the operator needs to get himself seated comfortably before adjusting the patient. So what we need to do is the operator needs to make sure the basics of ergonomics are right. So his thigh needs to be parallel to the floor, his back should be supported by the backrest. After the operator makes himself comfortable, the dental stool has to be adjusted according to the operator's comfortable position. Following this, the patient's position or the patient chair is adjusted. So for best ergonomics and for using magnification, the patient is always put in a complete supine or a flat position. The height of the patient positioning is determined by the comfort of the operator. So now the operator pulls the microscope down, and once the microscope is pulled down, now we don't bother about the focusing of the microscope. Instead, the operator just puts the microscope in his comfortable position, which is at the parallel level where the eyepiece is parallel to his vision. So now we can see that the operator is comfortably seated in his stool, and now the patient is put in a tentative vertical position, and the microscope is also set. But in spite of this, you can see that the operator is not at his best ergonomic posture, because the operator has to bend forward to look into the eyepiece. So this can be generally addressed with having an eyepiece extender in your microscope, or what you can do is you can just see here, the operator has to move forward, which is not good for ergonomics. So what we do is we pull out the headrest of the patient. Yes. So once the headrest is removed, now a neck pillow is given for the patient so that the patient is also comfortable. And once the headrest is removed, you can see that the operator's stool can now go very closer to the patient, and the operator's thighs can be below the chair. After this, now the operator is being seated comfortably very close to the patient without the need for him to bend forward, and now the microscope is pulled to position again. So you can see here the operator is making sure the armrest is in position and the microscope is in its very convenient position. So this is how we go about. So first the operator adjusts his stool for comfort. Then the microscope is positioned according to the operator's sitting, and finally the patient's chair has to be adjusted up and down to do the focusing. It should never be the other way around. We should not move the microscope up or down to focus, and we need not adjust the operator's tool also to keep the microscope on focus. So after this, it's always the patient's chair that needs to be moved up or down for fine focusing. So this way, the operator is always in a very comfortable position throughout the procedure. So you can see here, this is the most convenient position for the operator. He sits at a 12 o'clock position with his thighs parallel to the floor, with the back supported and the neck erect, and still at focus on the work. And this is the single position with which all the procedures are being done. So unlike in basic ergonomics where the operator moves his positions according to the clock positions, here the only position that the operator works is at 12 o'clock, and at times, yes, especially for beginners, you can go little closer towards 11 o'clock position at times for better hand-eye coordination. But as you gain experience, you realize that you always sit and work with the 12 o'clock position. So these are not hard and fast rules, but this positioning is recommended by most of the textbook and most of the leading authors, because this is one of the most ergonomic positions to perform all the procedures. And it is also important to know that once this ergonomic position is set, the operator should never take his eyes off the microscope. So it is very important for you to have very well trained assistant and work in a four-handed dentistry model where the assistant just places the instruments or the instrument transfer is done smoothly without the operator needing to take his eyes off the microscope. So you can see a small demonstration here. I'm just spreading my fingers and my assistant is placing the mouth mirror in the left hand in such a way that I can immediately grasp it and start working. And in my right hand she has given a straight probe here, but during workflow she'll be handling different instruments in such a way that I just grasp it in the shaft and start working. This is something that has to be practiced with your dental nurse or assistant even before you start the treatment when the patients are not there. So four-handed dentistry is extremely essential when it comes to advanced level of ergonomics. Now we'll discuss about direct and indirect vision. There is a common myth that when people use microscope, every procedure has to be done only with indirect vision. I myself was told so, and in the beginning it was a little tough for me to crack this. And now I'm going to tell you what are the procedures that you can do with direct vision under microscope and what are the procedures that you can do with indirect vision with a microscope or a loop. So the concept is simple. Whatever you can see directly, do it with direct vision. So the labial surface of the upper anteriors or the labial surface of the lower anteriors can be seen directly. So any restoration or any procedures that you perform in this aspect of the teeth can be performed in direct vision. You can see here again the occlusal surface to an extent and the buccal surface of mandibular right quadrant is pretty visible. So procedures that are done here like tooth preparation, veneer preparations, and again the maxillary teeth, the buccal surface, these areas can be visualized directly. Okay? So even administration of local anesthesia, this can be done in direct vision. So the logic is very simple. What you can see directly can be also done in direct vision. So local anesthesia administration is done here, and simple extractions or surgical procedures like these which can be visualized directly is also done in direct vision. And even during oral prophylaxis, you can see here the labial surface of the anteriors can be visualized directly, whereas when you work on the lingual surface of anteriors, we need to go in for indirect vision. Another example of a direct vision where we are going to do a labial access in this teeth as the situation demands it. Again, we are working with the direct vision. So even in posteriors, this is a common myth. People think when we work in posteriors, it's always a indirect vision. Not so, not necessarily. This is a mandibular second molar where endo is going to be initiated, and the initial occlusal reduction can be done very much with direct vision. Now, where do we do indirect vision then? So, indirect vision basically is for procedures that are to do work in some areas which cannot be visualized directly. So, most endodontic procedures, especially after your access cavity preparation, fall in this category because even in teeth where you can directly visualize the pulp chamber and the root canal orifice cannot be visualized directly, which will necessitate for you to do indirect procedure. So you can see here, this is how we work through the microscope. So though we can see the tooth directly, but I'm not able to see anything inside the tooth. So I'm keeping the mouth mirror just distal to the mandibular premolar here, and this is my front surface mouth mirror, and you can see the vision on the mouth mirror. So this is how we do indirect vision work on through the microscope. So all the maxillary molars, all the posterior occlusal surface of maxillary molars, all the mandibular molars. When we do endodontic procedure, again you can see here a mandibular molar. This is the tooth, this is the mirror, and this is the image, and this is what we finally crop to achieve the documented image. Microscopic documentation is done after clicking pictures this way. You can see here this is a mandibular molar again with the middle mesial. So once I work and I also keep clicking pictures, this is the unedited image that I get, and later I can crop it, and this is what I use it for my documentation and presentation. So the images that are obtained through the microscope are never attained with direct vision. Most of the images, especially of the pulp chamber and the orifice, are attained only through indirect vision, which is later cropped where the mirror is also cropped. So now let us see what is the mirror and instrument positioning for each quadrant, especially for indirect vision. So you can see here for visualizing the lingual surface, the palatal surface of the maxillary anterior, this is how we position the mouth mirror and the instrument. You can see the use of the finger rest here, and this is what we see through magnification. I am able to visualize the palatal surface of the maxillary anteriors. Now the mandibular lingual surface of anteriors. So this is how we position the mouth mirror. The mouth mirror is placed lingual to the lingual surface of the mandibular anteriors. So this is the maxillary molars, the first quadrant. This is how it looks like, how I hold the mirror and how I use my instrument. And you can see I can move the mouth mirror, I can focus the mouth mirror, I can move it from the buccal to the palatal, turn it based on the side that I want to examine or work. Now we are going to see how we hold the mouth mirror for the maxillary second quadrant, and this is how we examine. Same way I can use the mouth mirror from the buccal to palatal, tilt it to visualize different areas or different aspects of the tooth. So the maxillary teeth we are pretty familiar with, and the mandibular teeth are the ones that we are not very much used to working in indirect vision, especially in this part of the country as well. In mandibular teeth, how I position the mouth mirror is the mouth mirror needs to be positioned distal to the molar teeth, distal to the mandibular molars or the mandibular posterior teeth. So you can see the mouth mirror can be moved from the distobuccal to the distolingual based on which orifice or which cusp I want to focus on. And I'm also moving, this is how I can focus on a premolar. So all procedures on mandibular teeth are also performed through indirect vision. So this is the fourth quadrant now. We are examining the last molar, which is the second molar here. Again, you can see the mouth mirror is placed distal to the tooth, and the mouth mirror can be gently moved from the distobuccal to the distolingual. But the most comfortable position for working is the distolingual cusp. The mouth mirror is just placed distal to the distolingual cusp during the endodontic procedures. So this is how we focus with the help of mouth mirror and probe, and you can see that once you achieve this hand-eye coordination, even mandibular molars, the entire endodontic procedure can be done through indirect vision with magnification, making you enjoy the entire procedure. You can also literally see what every step is doing, the impact of each and every step, be it instrumentation or irrigation. So the chances of going wrong is very low. So endodontics is not a blind procedure. The use of magnification helps you in doing everything under control with precision. You can see this is a mandibular second molar, which is often dreaded for the difficulty of obturation, but with magnification and with proper ergonomics, you can see the mouth mirror is placed distal, and I'm only focusing on the mouth mirror so that you don't see the real teeth. It is what you're seeing, only the image. I'm able to place sealer with much control, and you can see how I'm going to do a down pack. So after placing the master cone, you can see the down pack unit is used to first shear the GP. You can see a passive down pack is being done. So everything is under control apart from your better ergonomics, which is good for the health of the operator. You are also able to perform procedures at the highest level of precision. So what we need to do, how do we adapt to this new ergonomic procedure, the advanced ergonomics from the basic ergonomics, is there is definitely a steep learning curve, but it is just like how you learnt your handwriting. It's just how you improve the hand-eye coordination, which comes only with practice. There is no shortcut. We need to keep repeatedly doing this, and the best advice that I will give for people who want to learn advanced ergonomics is to oral prophylaxis from this posture. From a 12 o'clock position behind the patient, using magnification, do at least 5 to 10 oral prophylaxis on patients. So that why I'm telling you this is when you use rotary high speed instrument with this new ergonomic posture, you may tend to do some errors in the beginning, and when you use a scaler, the chances of doing these errors are very less. And so this is one of the exercises that I recommend for people who want to master this hand-eye coordination at this highest level of ergonomics. So before we conclude, the take-home message is, though with basic ergonomics you can improve you can overcome the errors that you used to make in the earlier days, but still there is some amount of bending of the neck that is happening when you work with the naked eye, which can be improved with loops. So for people who are working with naked eye, it is always better to at least use loops for your dentistry, and the best way is to use magnification with microscopes, where you get the top level of ergonomics. So before I conclude, I would like to thank my team who helped me in shooting this video. The one on the extreme left is not seen in the video. She is Dr. Divya, who was behind the camera, and the one who's sitting as a patient is Ms. Kartika, she's a dental nurse as well, and the one on the extreme right is Ms. Hema, who is my dental nurse for almost 3 years. Thank you, my team. And for people who are more interested in some of our educational content, please follow us on our social media platforms. And people who want to know more of microdentistry, who want to master microdentistry, who want to do some hands-on exercise in microdentistry, like microphotography or the techniques using microscopes, please feel free to contact us for our training workshops. Thank you so much, and I'll see you soon in another video.